Well, it's time for Health Report, and joining us now is Africa 54 health correspondent Linord Moudou with more on Ebola and news of an international agreement to prevent future epidemics. Linord.
That's right, Vincent. U.S. Secretary of State John Kerry and African Union Commission Chairperson Nkosazana Dlamini-Zuma recently signed a memorandum of cooperation to formalize the relationship between the U.S. Centers for Disease Control and Prevention and the African Union Commission. The agreement mandates the establishment of an African Center for Disease Control. The formation of an African CDC has been under development for a few years now. The new institute, set to launch later this year, will work to prevent and respond to future epidemics like Ebola. And the World Health Organization's top official says the Ebola virus is still a threat for the international community, but the risk of its spreading seems to be diminishing. Dr. Bruce Aylward, a special representative of the Director General for the Ebola response, explains.
One of the things that really strikes you when you go to the emergency operating centers in Sierra Leone now is that they're talking about individual people and individual contacts rather than numbers of cases and rather than trends. And remember, Ebola is very much a local disease and a disease of people and individuals. And it's only when you really get down to the level of the individual that you really are on track for getting this thing eventually stopped.
Dr. Aylward says community engagement is very important in getting to 0 cases of the virus. In an interview with Straight Talk Africa host Shaka Sali, Sierra Leone President Ernest Bai Koroma says the Ebola outbreak has been devastating to his country's economy.
We are trying to reactivate the services in the country. This will require us to improve on the health infrastructure. We will be required to train more of our personnel. It will also require us to ensure that we put in systems that will focus on isolation, prevention, and strengthen our capacity to track diseases. Not only to finish up the fight against Ebola, but also to ensure that we develop the capacity that will enable us to fight back any future outbreak.
And you'll be able to see Shaka Sali's entire interview with President Koroma on next Wednesday's edition of Straight Talk Africa. Now, schools in the Sierra Leone capital have resumed classes 9 months after closing because of the Ebola outbreak. Paul Chapman reports.
This is the first time in 9 months these students in the Sierra Leone capital have gone to classes. The schools in Freetown, shut because of the Ebola outbreak, are opening their doors once more. It's a sign the tide is turning against the disease, and some of these pupils couldn't be happier to be back.
I want to be educated, and the government have announced that school is open, so I just need to come to school, no matter how the situation is.
Relatives of the returning pupils say they're satisfied with the health precautions in place.
The measures we've put in place really good because I see buckets them outside the classrooms them.
More than 10,000 people have died in Sierra Leone, Liberia and Guinea, where the epidemic was discovered a year ago. In Sierra Leone, the government estimated more than 8,600 children lost one or both parents to the virus. Nearly 1,500 children were among those who caught the disease.
And that's our Africa Health Report for today. Back to you, Vincent.
And thank you for that good report, Linord. Be sure to watch Linord Moudou's Health Reports every Tuesday and Thursday right here on Africa 54.